Oh, hey there, this is Dr. Evan Osar. You got your clients performing upright rows? Is it the worst exercise for your client's shoulders? Today, we'll discuss how you decide about the efficacy of the exercise for your specific client. Welcome, this is Dr. Evan Osar. Welcome to Integrative Movement Insider. I'm Dr. Evan Osar of Integrative Movement Institute. Hope you're having a great day, great start to your week. If you work with clients like we work with clients in Chicago, Integrative Movement Specialists, you have lots of clients that present with impingement syndrome, maybe shoulder pain, maybe even some of that chronic neck issue, and they often are getting jacked up by the very exercises that they're doing in their workouts. So one of the things that we always do as part of the Integrative Movement system, the system that we use in our clinic and that we teach as part of the Integrative Movement Specialist Certification Program, is we always teach our clients how to, I should say, the participants of the program, how to assess their clients to determine whether an exercise is appropriate or not for their client. Because if you were like how I used to be, hopefully I'm getting a little bit smarter, wiser in my older age here as I get a little bit older. Hello, Sue Gleason, how are you, my friend? Part of our Integrative Movement Specialist community. What I used to do is say that exercise is no good for your shoulders because it wasn't good for my shoulders. So if I didn't like an exercise, or I should say more specifically, if it hurt my shoulders, caused me impingement syndromes like many exercises did back in the day, led to me having bilateral rotator cuff tears, bilateral labral tears in my shoulders, and chronic shoulder issues. Hey, Stephen, how are you, buddy? Good to see you as well. So many exercises contributed directly to my shoulder issues. One of the exercises I did lots of early in my career was upright rows. I loved it. It felt great on my shoulders. My shoulders were much bigger at one point in my life, many years ago. And I really loved how it made my shoulders feel. My arms felt all pumped like afterwards. Now I'm just a scrawny, older guy. So that exercise and lots of other exercises, dips and heavy shrugs, with sticking the head out and squeezing the shoulder blades back and forth, and lots of other not great exercises, directly set up my shoulder issues. We talked about that here in our Facebook Lives. Now, how do you determine if something like the upright row is appropriate for your client or not? Because in our industry, like I used to do, it wasn't good for me, so it wasn't good for anybody. And then I would learn maybe a little bit more, and it's still really biased by either what I felt in my own body or what my guru or my mentor would say to me. Now I don't go by that at all anymore. All I have to do is assess my client and watch them perform an exercise and then check their range of motion after the exercise. If the range of motion is still appropriate or good or optimal, then the exercise is probably pretty okay for the client. If it shuts their range of motion down, meaning it decreases the range of motion, it probably isn't a great exercise, and or the form was not great, and or the weight was too heavy. So here's a quick, easy way to determine if upright rows are really the best exercise for your client or maybe the worst exercise. Because for a lot of your clients that have impingement issues, that have acromial clavicular issues as far as they have a hooked acromion or bone spurs on their acromion, if they have labral tears, if they have chronic neck issues, upright rows are terrible for their shoulders. But let's determine whether or not it is appropriate versus just saying, oh, it's bad or it's good. First of all, think about this exercise right here. So if I'm doing upright row, I need a lot of internal shoulder rotation. I need lots of internal shoulder rotation to make that movement happen. So you first should look at whether your client has enough internal internal shoulder rotation to make that movement. So quick, easy assessment. Doesn't take, a rocket scientist to figure this out. Put your shoulder out here, 90 degrees, elbow 90 degrees. And all you do is look at internal rotation. And you have to look at pure internal rotation, not what it looks like I can do by throwing my whole shoulder into elevation and anterior tilt. That's what it looks like if I don't control it. That's what it looks like if I do control it. So if I'm doing an exercise like upright rows with this kind of range of motion of my shoulder, it has to be compensated. There's no way for me to get it without the weight. So how am I magically going to get it once the weight's in my hand? So that means that every single time I'm doing a repetition of upright rows with more than my available 20 degrees of internal rotation, I will jack up my neck and or my shoulder. And my shoulder range of motion, if you check it before and after, it will go down every single time. And so will your clients. And that's why it's important you are doing pre and post assessments if you're trying to determine if an exercise is appropriate for your client and or not. And if you're not, you're really just guessing. You're just guessing and saying, oh, that exercise is good and or not good or has no effect on my client. You don't know because you're not assessing for it. So one of the take homes from today's Facebook Live is don't guess, assess. Assess your client to determine if they have the range of motion to do the exercise you want them to do. Then watch them perform the exercise, then check the range of motion after. If the range of motion stayed and or increased, which it should if your client is using optimal alignment and control, the range of motion should at least be the same and maybe even go up. If they lost range of motion, it's not my rules, it's the nervous system's rules. The nervous system will shut down range of motion if it's trying to protect itself against impingement or overstress, or you're putting the joint in a suboptimal position. The nervous system will decrease range of motion to protect you. Again, range of motion does not lie. Your ego will lie to you. Like my ego lies to me all the time and makes me do things in the gym that I should not be doing, or makes me do weights that I should not be handling in the gym. And then I check my range of motion. I'm like, yep, jacked up. My neck feels a little bit tight after that. But when I respect what my nervous system is telling me, when I don't let my ego get the better half of me or get over on me, then I leave the gym and I feel awesome. My range of motion is great and I feel great, and it was a productive workout, and I could come back and hit it hard the next time. So I hope that makes sense. I hope it really helps you start to pay a little bit more attention to your assessments and what your assessments are telling you about your client and how your client is moving. In the brand new series of 2 Anatomy Geeks, we're going over these kind of assessments. We'll talk about very common issues, like how internal rotation is such a huge piece of why your clients have chronic rotator cuff issues and bicep tendon issues, as well as labral issues as well, and how you can use some very specific assessments, how you can use very strategic corrective exercises. Hello, my friend Jackie Bachmeyer, my good friend down in Houston, Texas, another integrative movement specialist, part of our community. We'll show you how to use these specific assessments. We'll teach you about the anatomy of common orthopedic issues so you understand why your clients are jacking up their rotator cuff or their labrum, and or they had a chronic neck issue, which is also related to what they're doing with their shoulders. We'll show you how to use the most effective assessments to determine the impact of your exercises and or your progressions that you're using with your clients, how to know when to progress your clients. And we'll teach you how to communicate with physical therapists and chiropractors so that you speak their language and help them feel confident in referring their clients to you, because we want to help you not only understand common shoulder issues, but also have strategies to help you address common shoulder issues like biceps issues, rotator cuff issues, labral issues, chronic neck issues, all things shoulder issues. We even talk about dislocations because I'm seeing lots of clients right now, young clients, young athletes. When I say young, 20, 30, that's young to me now. So I'll share with you some of the information, because a lot of these, or I should say a bunch of these young kids are having these surgeries that are jacking their shoulders up like real bad. And they're getting some bad advice. I shared a story with you about a current client I'm working with who's surgeon, again, top surgeries center here in Chicago, who wanted to remove or detach the rhomboid muscle. Again, the #1 orthopedic, the place where I would recommend, up till now, I would recommend my clients to go there for shoulder surgery. Obviously, not anymore. Because again, you can't tell me you understand shoulder and you understand shoulder function and then tell the patient that, oh, your shoulder's snapping or making noise, so we're just going to remove that muscle. It tells me you know nothing about function. Very little to nothing about function. So we want to help educate you so you can help educate your clients and also help determine whether surgery is appropriate for your clients. So you can help give them information. You're not telling them to do it or not to do it. You're giving them appropriate information. So we want to make sure that you are informed so you can inform your clients and attract more individuals that need, want, and will pay for your expertise. I'll put the link next to this video. If you're watching this from our newsletter, so sign up for our newsletter. We send out tons of free information, great information that you can use and apply at Integrative Movement Insider. And then we'll send you the link, or I should say check out the link and sign up and enroll. And then we'll apply for CECs once this series is done. It's the last series of this year to get your CECs. And this is an accreditation year, so you need those CECs this year. Well, hope that makes sense. Love to see you. This is Dr. Evan Osar with Discover IMI. Would love to see you in this brand new series of 2 Anatomy Geeks. Not this Saturday because it's a holiday, but the following Saturday, so 10 or 11 days from now. Make it a great day. Go out there and lead. Be the example. Be the light for your clients and your potential clients. Help bring people together, and let's go change the world. Take care.